Hi everyone, it's Paula from Strong Chatty Chicks with a Chatty Chick Side-Note on endometriosis. Endometriosis is a complex condition that involves the immune system, hormones, genes, and both local and stem cells. There's no single theory which explains all aspects of endometriosis, and it's estimated to affect approximately 190 million women and girls worldwide. Endometriosis occurs when tissue resembling the lining of the uterus grows outside of the uterus. These lesions can be found on the ovaries, the uterine tubes, the bowel, and the bladder, and in rare cases, they can even appear outside of the pelvis. So there are several types of endometriosis, with one being superficial endometriosis, and this affects around 80% of women with endometriosis. In this case, the lesions invade the peritoneum, which is the lining of the abdominal cavity, and it might involve just one lesion or as many as 50 lesions. So another type is ovarian endometrioma, which is seen in 2 to 10% of all women of childbearing age and in 50% of women who are seeking infertility treatment. So this occurs when that endometriotic tissue grows inside of the ovaries and forms cysts. So deep infiltrating endometriosis is less common. It affects around 20% of women with endometriosis. It involves lesions infiltrating more than 5 millimeters or deeper into the layers of tissue. These lesions can be found in various areas, like the bladder, the rectum, the bowel, and even beyond. So symptoms of endometriosis are numerous and they can be debilitating. They range from painful periods, painful ovulation, and pain during intercourse, to generalized pelvic pain, bloating, vomiting, and painful bowel movements. These symptoms might also include heavy or irregular periods, infertility, and emotional challenges like depression or anxiety. It's important to note that it's not just a painful period. So early diagnosis and treatment are crucial to managing symptoms and improving the quality of life. However, diagnosing endometriosis can be challenging due to overlapping symptoms with other conditions. Unfortunately, also stigma around menstruation often leads to these symptoms being dismissed or hidden, and there are no clinical markers for diagnosis currently. This leads to a common scenario where many women are initially misdiagnosed or told that their pain is normal. Consequently, diagnosis is often delayed, leading to prolonged chronic pain and heightened risk of complications. On average, the diagnostic delay for endometriosis is a staggering 7 to 9 years globally. And this delay has significant physical, psychological, and financial impacts on patients' lives. So diagnosing endometriosis involves a pelvic exam and possibly imaging tests like ultrasound, CT, or MRI to rule out other conditions. Remember that endometriosis can't be ruled out based solely on imaging. Unfortunately, there is no known cure for endometriosis, and treatment typically focuses on managing symptoms. Over-the-counter pain relievers can help with milder symptoms, while prescription medication is targeted at more severe pain. Hormonal therapies such as birth control pills, patches, and shots can help regulate hormones which might be triggering painful flare-ups. And if medical treatments prove ineffective, then a minimally invasive surgical procedure called a laparoscopy may be performed. This procedure allows surgeons to visualize and to remove the endometriotic tissue and is the only definitive diagnostic method. The chronic pain and discomfort caused by endometriosis can impact daily activities and quality of life. Symptoms can lead to social isolation, it can affect social activities and relationships, and severe symptoms can affect work productivity, absenteeism, career opportunities, and earnings. Living with endometriosis takes its toll on mental health, causing anxiety, depression, and other emotional challenges. Thank you for listening. Let's raise awareness about endometriosis among our friends, family, and the community at large. Please share this video and your experiences to break the stigma around menstruation. Join us next week for an episode of the Strong Chatty Chicks podcast, where we'll be talking about cyclical fitness. In the meantime, stay strong and stay chatty, you strong, chatty chicks.